The past year, we sought ways to find solutions to your medical queries with the help of our most trusted health experts. From the most common to the most complicated and rare, we provided answers to common health problems experienced by most Filipinos today. Tonight on MedTalk, as we usher in our first anniversary, we look back at some of the top killer diseases in the country and revisit the sound advice given by our guest doctors on the show. And together, we'll continue to find answers to all your medical concerns. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel. According to the Philippine College of Physicians, or PCP, 60% of Filipinos die from non-communicable diseases. These are non-infectious diseases like heart disease and different types of cancer. Recent data gathered from the National Statistics Office suggest that 1 out of every 5 deaths in the country were of cardiovascular causes. Our guest doctors focused on some of the most common risk factors such as unhealthy diet, lack of physical exercise, and even smoking, among others. The heart is the organ responsible for circulating blood throughout the body. But when the heart works harder than normal to distribute blood through the blood vessels, this can be due to hypertension. Hypertension or high blood pressure is a chronic medical condition wherein the blood pressure in the arteries rises.
For a person to be hypertensive, he or she needs to have a blood pressure of greater than 140/90, consistent na blood pressure. Na high blood pressure does not mean na nahirapan siya mag-pump ng blood, pero it needs to pump at a higher pressure para ma-meet yung requirement.
According to the Department of Health, 1 out of 4 Filipino adults suffer from hypertension.
Hypertension is more commonly associated with the older population, but it's not impossible for the young people to have hypertension.
Okay, Doc. So we go back to the causes, signs, and symptoms briefly of someone.
As I've told you earlier, most of the time there are no symptoms of high blood pressure. And this makes people more prone without knowing that they are candidates for cardiovascular events in the future. Then who should have their blood pressure checked? Anybody, but at age 20 at least, no? Of course, in the pediatrician's clinic, the pediatrician should take the blood pressure of their patients. At 18, they are not pediatric patients anymore, technically. So at 18, have your blood pressure checked. If it's normal, then have it checked at least once a year.
Okay.
To know whether you have high blood pressure or not. Following the same protocol, which is well rested, no smoke, no coffee for 30 minutes.
How about, for example, when one is about to work out and maybe you're excited, you're nervous, or any other emotion that goes into that, and someone takes your blood pressure, or maybe the gym takes your blood pressure, and it's very high. Should you still engage in that sports activity?
Well, there are physiologic rises in blood pressure, excitement, anger, happiness, no? These are active situations in which the blood pressure may elevate. And I think I always tell my patients it's more abnormal that you're excited and happy and your blood pressure does not move, no? It doesn't react. But then it should go down when the emotion has
Maybe
stabilized,
while you're doing
no?
the activity.
So exercise per se, before an exercise, unless you're really excited to do the gym workout for that time, should not necessarily cause elevation of blood pressure. So it might be emotional in that case, no? If it's screening, but of course if you're a known hypertensive, that's a different story altogether. If you are hypertensive and your blood pressure is high before you engage in exercise, then it might be time first to have a reassessment with your physician to see, evaluate if your medications are still good.
There are also other types of hypertension.
Yes, Doc.
One of these is what we call white coat hypertension. White coat. When they see a doctor or they are in the doctor's clinic, their blood pressure tends to go up because of anxiety or fear or whatever nervousness maybe. There's also, other than white coat hypertension, you also have pseudo hypertension. No? Pseudo means you are not really hypertensive, but you are hypertensive because of some events. Or maybe you are taking some substances that may cause hypertension. What I think wanted to talk about was pseudo-resistant hypertension. No? Pseudo-resistant hypertension is when your blood pressure is not well controlled. Pseudo, but it's not really not well controlled. It's because probably you are inadequately medicated, probably you're taking it at the wrong time of the day, probably you are not taking the right dose, or probably you're not taking enough medications. So that's called pseudo. The other point I want to raise is the issue about resistant hypertension. You have a patient who cannot reach a target level of less than 140 over 90 with so many medications already, you know. And that is called resistant hypertension. And people with resistant hypertension have a higher risk for complications of hypertension, which are mainly heart attack, heart failure, strokes, and kidney failure.
Is that your specialty also interventional?
Well, lately there's some
Cardiology.
excitement in the interventional field of cardiology because we now have a gadget that will help medications control blood pressure. Medications most of the time would be able to control blood pressure together with lifestyle changes.
Generally, we'd like to think that our control is pretty fair, although compliance to medications and stuff like that are not exactly good, but only in really very adequately treated patients, and they still refuse to, the BP still refuses to go down. Would
Compliance,
would that
can
be
be a problem.
consideration?
Discussions on the show also typically led to different cases of cancer, another growing concern for most Filipinos. The World Health Organization even predicts that cancer deaths may reach 17 million by 2030.
I was diagnosed with endometrioid carcinoma early this year. I was diagnosed with breast cancer stage 2 at the age of 48.
I was diagnosed when I was 11 with ovarian cancer.
In women, there are 6,000 cases of cervical cancer diagnosed each year. In 2010, there were 2,165 new cases of ovarian cancer and 1,760 cases recorded for uterine cancer. According to studies, breast cancer is the leading cancer that hits women in the Philippines. We'd like to understand what is cancer and how does this develop?
So cancer briefly is a malignant tumor. Oh, what is a tumor? It's a abnormal and functionless tissue. So what makes it malignant? Malignant means it's not benign. So malignant means that it has the ability to invade other tissues or spread outside the confines of its original tissue.
The main topic of tonight's episode, we're talking about the different types of cancers in women. Let's first talk about breast cancer.
Yeah.
Well, it usually presents with this abnormal lump in the breast or abnormal changes, skin changes or nipple changes. And this cancer in the breast that is detected has, depending on the stage that it is diagnosed, it has the ability to spread to other tissues. So that's what happens to the woman. It has the ability to spread outside the breast, to the lungs, liver, bone, and brain.
And you mentioned early detection is key. So
That's right.
how do we examine our breasts properly? How do we detect if there's something wrong or there's something amiss?
Every month, you do it 1 week after the first day of menses. First, you stand naked in front of the mirror and then observe your breast, the symmetry, if there's a nipple discharge, skin discoloration. You you examine it with your arms above your head, and then also doing this on your hips, you know, holding your hips to see if a mass pops out from the breast, actually, that it tightens the muscles. Then usually you do it while lying down with one of your arm underneath your head and with a pillow underneath, okay? And then so you palpate your right breast with your left hand and palpate your left breast with your right hand.
How about ovarian cancer? How does this develop in a woman's body, and what particular, is there a particular area for the ovarian, for the cancer to develop?
As to how it develops, no, at this level of our understanding, science, medical, we still don't know really what causes ovarian cancer. Most of it is really spontaneous. There's a small minority, of a small percent, which is really genetic, no? But it's really small. Most of it is spontaneous. Sometimes a patient will start feeling heaviness or pain, and usually when they have symptoms, it's already late because it's a mass already growing. The strategy is really to detect it while it's really early. But for ovarian, for some reason, we haven't yet developed the tests that can really detect it early. Most often, when we diagnose an ovarian cancer early, it's parang chamba lang. No? A patient gets operated on for something else, for a myoma, something benign, and then whoa, they see an ovarian cyst, they have it biopsied, it turns out to be cancer. So that's why it's very important for women to have that regular checkup, you know, at least once a year with their gynecologist. That's the benefit of that.
Again, early detection is always key. Any parting words, last message, or tips to our viewers?
So cancer is a disease. It's really nakakatakot, no, but it can be cured, as Dr. said. So once they know it can be cured, we have the way to treat it. I mean, that would encourage them to come and do it. The delay is what is sometimes the problem. They know there's something wrong, or the doctors told them you have this problem, it has to be treated this way, but they tend to, delay, just out of fear, no? Because they're afraid of chemotherapy, makakalbo ko and everything, mga ganun. But, kaya. It can be treated, you can go through it, you just have to do it, and you'll turn out okay.
After the break, we'll look back at some of the insights of our most trusted doctors as they tackle two more troubling diseases in our midst: diabetes and dengue. All these and more when the best of MedTalk returns. Welcome back to the best of MedTalk, a rundown on some of the most memorable moments on the show. This time, we'll look back at the episode on diabetes. Definitely a growing global epidemic, with one person dying every 10 seconds because of diabetes-related complications, according to the Department of Health. Diabetes is a metabolic disease in which a person has high blood sugar. This happens when the pancreas does not produce enough insulin, or when cells do not respond to the insulin that is produced.
There are several risk factors, and one is if you eat a lot of the sweets or sugar. If it's diabetes type 2, it's more on insulin resistance. So this involves your diet, and if you have a sedentary lifestyle. Diabetes is actually a worldwide problem. It's very, very prevalent. As of right now, around 2010, there are around 200 million individuals who are diabetic worldwide. So this number is actually, they say that this number would double in 2030. So we need to address diabetes right now.
How does one, is one predisposed to it? Is it genetic? Is it environment? Is it the lifestyle? Is it the food we take?
Diabetes actually consists of two things. It could be inherited, but you don't inherit the disease. No? You inherit only the predisposition to develop the disease. And in order for you to develop diabetes, the environment should trigger it. No? So the genes don't act alone. No? It has to be with the environmental trigger.
Sedentary lifestyle, of course. As children and as Filipinos, we are also at a high risk for developing diabetes. Asians in general.
Why is that?
Well, maybe it's the race and it's probably culture. As children, oftentimes we're happy that our children are fat because they look healthier. But then again, later on, they can get predisposed to diabetes if they continue with their lifestyle, like high carbohydrates and high fat intake. And right now, all of our children are exposed to the fast food.
Yes. Okay. Let's talk about the types of diabetes and how is it detected.
Gestational diabetes is diagnosing high blood glucose among those who are pregnant.
The most common is the type 2 diabetes. It is the one that wherein the person does have enough insulin or maybe more than enough insulin, but because of some reasons, the body is not responding to the insulin. So that's why the patient also develops high blood sugar and type 2 diabetes.
How about type 1 diabetes? Please describe to us this type.
Type 1 diabetes, formerly known as juvenile diabetes or insulin-dependent diabetes, although we don't use that term anymore. It's really type 1 diabetes. Usually these are diagnosed among children. The sugar goes up and then the parents would notice that their children is not gaining weight. They keep on peeing a lot. As babies, they cry a lot and then they go to the emergency room and then they diagnose the children with type 1 diabetes because of the high blood glucose, and they are required to have insulin shots already.
Insulin is a hormone.
Yes, it is.
Okay. And how does one, when this hormone is not functioning well, what happens to the individual?
Oh, well, your sugar accumulates in the bloodstream, and of course, if it's in the bloodstream, it goes to the different tissues in the body. So if it's so high, then it can accumulate in the eyes. You can have your retinopathy, okay? You can have early cataract formation. If it's in the kidneys, your kidneys ordinarily would filter out the sugar. So ordinarily when you pee, your urine comes out without the sugar. So if it accumulates and it goes through the kidneys often, so it can damage your kidneys. You can have nephropathy or kidney disease due to diabetes. Also, you can have complications in the heart. You can have cardiovascular disease, atherosclerosis. You are at a high risk for developing cardiovascular disease once you're diabetic.
On that note, general conclusion for tonight's episode on managing, understanding, and controlling diabetes.
I think what is important is that we know the risk factors for diabetes, and if you have diabetes in the family, as parents, maybe perhaps we should educate our children. And if we have diabetes, as much as possible, we should educate ourselves, because one of the most important, as I said, know your enemy so that you can combat it. And it is very important because of the many progress in the type of diabetes. It's not saying that you know all about diabetes at this point, because us also, we study all the time because there's a lot of progress going on, and we should continue educating our patient. Okay, and as I said, you cannot fight diabetes without doing lifestyle, diet, and exercise. Medication will be used if needed, but those are not the most important treatment for diabetes.
Thank you, Dr. Sisan. Dr. Fohas?
Type 2 diabetes is very, very preventable, and if detected early, maybe might be able to reverse it. Just do lifestyle modification. Just consult your doctors. Have yourselves checked. Don't be scared, because the earlier you get it, the easier it can be managed.
Here on MedTalk, we also got a lowdown on dengue. In fact, the Philippines is in the list of Asian countries with the highest incidence of dengue across the Western Pacific, according to the World Health Organization. Dengue is an infectious tropical disease caused by the dengue virus, carried by a species of mosquito called Aedes aegypti.
Basta mayroong stagnant water na pwedeng pangitlogan ng lamok, andyan sila, nagtatribe sila, nagpapalago sila, nagpaparami po sila.
Dengue should be suspected when one reaches a fever of 40 degrees Celsius. It should also be accompanied by two of the following symptoms: severe headache, muscle and joint pains, nausea, and vomiting.
Tinatawagan po natin yung ating mga kababayan, yung attention po niya, huwag pong maging komportable, basta panatilihin po natin malinis ang ating bahay, ang ating kapaligiran, ugaliin po natin check-in ang ating mga panubigan.
According to the Department of Health, there were 2,332 dengue cases from January to April of this year.
What else will the health practitioner do to determine if one indeed has dengue?
They have to get the history, say, do other persons have fever around the area or within the community, so as they can have an idea if this can be associated with dengue.
Mm-hmm. And you mentioned also the community, Doctor. Now let's go back a little bit to how the community deals with sometimes we have open spaces or open areas that are filled with water that are not cleaned right away. So, pwedeng bahayan yun ng dengue mosquito.
So, if you have open canals or pools of water, you have to declog the canals so as the water will flow. Or if you have pools of water, then you can probably cover it with soil.
How about the vaccine?
With regards to the vaccine, we're supposed to come out with the vaccine next year, 2014, but we just want to be sure of the protection that it will give, so probably it will come out in 2 years' time yet.
So we really have to stress that, you know, we have to be mindful of our environment, of our surroundings.
Yeah, definitely.
Any other last tips or messages, Doctor, or maybe the 4 S's of preventing dengue before we let you go?
Still, we still advise our residents to make sure that you implement the 4 S's that have been suggested by the Department of Health for several years now.
Yes.
The first S states that you have to first search and destroy breeding sites in the area. That is still the best way wherein you can be assured that you will not get dengue. The second one, if this does not take effect in your area, then you have to do self-protection. Now, you have to protect yourselves by using repellents or modify the way you dress. No? And then the third S stands for seek early consultation once you feel something different from your body. And the fourth one is you have to use only fogging when it is intended or when there are outbreaks.
Okay.
Yeah. And another one is the 4 o'clock habit was coined just to standardize the time of cleaning your surroundings, but actually you have to be sure that every time of the day your surroundings are clean and there are no water holding containers within the area.
Mm-hmm. It's also good to know that there's a 4 o'clock habit, and there's a habit that we should keep, we should maintain, we should remember.
Yes,
cleaning our surroundings.
and lastly, we have to bear in mind and we have to be aware that it is us, the residents in our community, that actually are the cause of dengue.
Because if we don't clean our surroundings, then may pagbabahayan.
And may pagbabahayan.
Ang mga mosquito. So
Yes.
it's homeowners' responsibility
Yes.
to clean their surroundings and make sure that this mosquito doesn't thrive in that area.
Let's try to refresh our memories this time with the topic of kidney disease in mind. A lot of us do not realize how valuable our kidneys are as it cleans waste materials. Let's play back some of the most interesting insights from that discussion. For Efrain Tumaning, a retired policeman, dialysis treatment is nothing new. If many are intimidated by this machine, Efrain has gotten used to it. He undergoes hemodialysis twice a week due to severe kidney failure.
The kidneys are generally functions to filter the blood. Yung lahat ng mga solutes and all of the compounds that we take and all of the metabolites of our system generally is being excreted through the kidneys. Nagkakaroon ng stasis ng urine within our bladder. So what happens is that dun sa stasis ng urine sa bladder natin, nagkakaroon ngayon ng environment na very prone to develop stones.
How do we describe a healthy kidney? What are the characteristics maybe of a healthy kidney?
Well, the characteristic of a healthy kidney would be one, it's able to excrete the adequate amount of urine. So depending on your fluid intake, an average of 1 liter would be okay. So that's one. Secondly, you don't have any pain, or when you excrete urine, it has to be yellow, light yellow in color. Because if it's dark, it means that you're not taking in too much fluid. So that's also bad because if you have a concentrated urine, you will have crystallization that can bring about the creation of kidney stones. And it should not be, it does not have blood. It should not have blood. And when you urinate, you should not have any pain. Because when you have pain, it means that you have an infection or you have a kidney stone that is being passed out in your urinary tract.
Talk about the treatments available. We've talked about the signs and symptoms. We've answered our Facebook questions. Now let's talk about the treatments that are available to those who have been diagnosed with kidney failure. So what are the treatments, Dr. Perez, available here in the country?
If you have an acute kidney injury, the extreme case would be the patient would undergo hemodialysis.
What is hemodialysis?
Hemodialysis is basically a treatment, a device wherein we have a filter and then we insert a vascular access, usually at the neck area, and the blood is taken out from your body. It goes to the machine, it goes to the filter, and goes back to you. Now the filter or the dialyzer basically removes all the toxins of your body. At the same time, it removes the excess water in the body. Now, but if, for example, a hospital does not have a facility, a hemodialysis facility, a peritoneal dialysis would suffice. Now, the peritoneal dialysis is different in the sense that we use our peritoneum or omentum rather as our dialyzer. It's the supot ng tiyan. And then we put special fluid inside our stomach, and then we let that special fluid stay in our stomach for a couple of hours. Then it's removed out because that special fluid will be the ones to absorb the toxins at the same time remove the excess water in our bodies. So that's for acute. Actually, those two modalities that I've mentioned, we also use it in chronic kidney disease. But the ultimate treatment for chronic kidney disease, those who are in failure and both kidneys are already damaged, would be kidney transplant.
Right away. So they are candidates for a kidney transplant if the dialysis, the hemodialysis does not work for them.
Actually, chronic kidney disease, in chronic kidney disease patients, both the hemodialysis and peritoneal dialysis are just temporary measures. It's like tiding them over to the next day. But strictly speaking, if you want them to have a new normal life, then a kidney transplant would be best for them.
Yeah, we consider the kidney transplant as the best option for renal replacement therapy because that usually puts them in the mainstream of life again.
And that wraps up the best of MedTalk for 2013. A look back at the top killer diseases among many other discussions that we've had on the show. See you again next Tuesday on MedTalk, this time in our new and longer time slot from 7 to 8 p.m. in our new home on RPN 9. This is MedTalk, your scheduled on-air consultation on the Solar News Channel. I'm Angel Jacob. Good night.